Hi, and thank you for watching On the Front Line at Dr. Allen LA. I hope these videos have been very helpful in giving you the opportunity to understand what's going on with the coronavirus out here on the front line. A brief history of the patient we're presenting today, which is our 7th positive coronavirus test in our area. This gentleman is a local resident of both San Bernardino and this area, which his doctor referred him to us for testing because we're the only testing facility in this area. Now, we'll sit down there and then we're going to go ahead and have Teresa open the goggles for us, and I'm going to ask you to lay back for me. Yeah, with your head right here. Put that over my head there. That's just we'll do it the other way. Yeah, there you go. All right, we're going to give it this way. Very good, I got it. Yeah. All right. Now, I want you to put yours on as well. So his doctor's in San Bernardino.
Yes.
And then they say call his doctor.
We spoke to a nurse and they told us that to come to get him tested as soon as possible.
Right.
He was having fevers as well. So he was having fevers. They just stopped a day ago, 2 days ago. Like he had it for 2 days in a row.
And told him that we were testing.
Yes.
Nice. The community is becoming aware that we are here.
Mm-hmm.
All right, okay. I got to swab the back of your nose. All right. It's not. So I'm going to go right here first. Then I'm going to go all the way there, get a good swab, and perfect. That's all there is to it. All right. Now, are there any questions? So, Jose will bring it to his car, and we should be talking tomorrow. Now that you've seen the testing, I'm going to go over the results before I talk to the patient and explain to you what the results are saying. Remember, they're coming back in less than 24 hours, allowing you the opportunity to see the entire story as it unfolds. Here, the individual that we just spoke to comes back as a positive coronavirus test. As you know, this is our 7th test. Here, I want you to see the test was collected yesterday at 3/31 and reported back today, 4/1/2020. The results are coming back that fast. I'm going to go speak with the patient now. Got to make sure that that's you there. Okay. I have to tell you, you're positive for the coronavirus.
Oh, really?
So that means more likely your wife may consider being tested as well because your husband is positive. The way it works now is I'm gonna give you all these copies. This is what we send to the CDC. And then the next copy is the copy that we have to send to the public health department. And then what they're going to do is come out and quarantine the family.
So van a hablar ustedes en como 24 horas te van a cuarentenar. Sí.
Because the idea is the more we can quarantine and stop the spread.
So es importante que cuarentena para proteger más gente.
The quicker it is to stop, the more we can quarantine and keep people in, the least likely they are to spread the illness.
So si quedan en casa en la cuarentena, menos gente se van a enfermar.
¿Cree que los síntomas me vayan a salir más o cuánto? Si ya tengo 6 días con estos síntomas.
What the symptoms get worse, progress, or like?
I've had cases where the symptoms have gotten worse, and I had to hospitalize patients. And I've had cases where the symptoms have gotten better, just like a regular flu, and they've gotten better. It's hard to say right now. How do you feel right now?
I feel like okay.
You feel like you're getting better? I've seen from the patients that, like yourself, who's starting to feel better, they do well.
And they can be worse or well?
Normally, if you're getting better, you tend to get better. And when it doesn't improve.
Because symptoms, I have like symptoms that I don't have like past days. I have like new symptoms like every.
What are the new symptoms?
Diarrhea.
Diarrhea.
Yeah.
Diarrhea has been one of the findings. Abdominal pain, chest pain. So, but yet, as long as the fever is down and you're starting to feel some strength, it seems like you may get better. You just got to really hydrate yourself.
Yeah.
Now that we're able to see the entire beginning to end of what happens on the front line, from testing, getting the results, and talking to the patient, this opportunity will allow us to try to help you deal with the pandemic. There's several things that I think these videos should tell you. One, try your best not to panic. If you've seen anything, I've had a large proportion of the patient have the illness and recover. Yes, there was some coughing, fevers, runny nose, sore throat. In this particular episode, this gentleman did develop the side effect, or develop diarrhea and nausea. The disease takes on several characteristics. That's one thing you should know. Some of the literature is saying it can present as just pink eye. That's something you should know. But nevertheless, I think that my reason for having these videos is to stop the panic that everyone that gets the disease is going to die. That is an untrue story. A lot of the people recover and do well. Trust me, I may have actually had it and have done well. At the end of the day, the widespread panic of the COVID virus or the coronavirus killing us is not as prevalent as what we're saying. Remember, my reason for doing this is to get out here and see. I won't be able to tell you this without seeing the disease myself. Because I'm allowed, or I'm able to get out here and deal with the patients and study and understand the illness, I have a pretty good clue of who can actually have the illness now and who doesn't. I have a pretty good clue of who's going to get real sick and require hospitalization, and those who are ready to go home on some antibiotics and rest and recover. Everyone that contracts the coronavirus doesn't have a death sentence around them. That'll help you deal with the fear factor. There are several things that can lead one to hospitalization. 1, malnourished. 2, prolongation of the illness before you found out you had it, and or not starting early antibiotics, which is what I've seen. And lastly, elderly or underlying conditions, which is hypertension, diabetes, dialysis. The rest of us, we do well with fluids, antibiotics, and time. Until next time, I look forward to seeing you again on the front line and at Dr. Allen LA. And I thank you for watching these videos.